So moving to the next question, which of following bones do not contribute to the nasal septum? Well, your answer here is, the answer is lacrimal bone. Well, remember, for your entrance exam point of view, the lacrimal bone, it is a small bone that is located in the orbit and it does not play a role in formation of nasal septum. The nasal septum, it is primarily formed by the perpendicular plate of the ethmoid bone and the bomber bone, with some contribution from the septal cartilage. So the other bones have sphenoid, palatine and ethmoid, they have some involvement in structure of nasal septum, while the lacrimal bone does not. So your answer is a lacrimal bone. The next question, the maxillary nerve, it leaves the middle cranial fossa by passing through. The answer is foramen rotundum. Well, for your exam point of view, just remember the foramens, the position of the foramen. Many a times in entrance exam you can get a question, identify this foramen, identify this foramen or identify this foramen. So remember the foramen location of the foramen lacerum. It is the foramen lacerum. It is located at the base of skull, and the maxillary nerves leaves the middle cranial fossa through this foramen. The foramen spinosum, well, it is located in the middle cranial fossa. As it exits the foramen spinosum, it is located in the middle cranial fossa and it is not related to maxillary nerve. It transmits the middle meningeal artery and the vein. The foramen rotundum, the maxillary nerve passes through the foramen rotundum as it exits the middle cranial fossa. So your answer is B. The foramen ovale, we have discussed that before in another MCQ. So your answer is foramen rotundum. The retromandibular vein, it is formed by union of two veins. That is, one is the maxillary vein. So this maxillary vein, and other is the superficial temporal vein. So these two veins form the retromandibular vein. So retromandibular vein, it is formed by union of these two veins. It continues to drain blood from the head and neck region, and it joins with the facial vein, the anterior facial vein, to form common facial vein that drains into the internal jugular vein. So your answer, retromandibular vein, it is formed by the remember, it is formed by the union of maxillary vein and the superficial temporal. Which branch of external carotid artery originates at the hyoid bone? The answer is the lingual artery. The lingual artery, so this one is the lingual artery, as you can see here clearly in the pic, and this one is the hyoid bone. So this pic is from BD Chaurasia. Please follow these standard textbooks. The BD Chaurasia is must for your entrance examination. Many questions, they are direct pick from this book, BD Chaurasia, or the Gray's Anatomy. So the lingual artery, it originates from the external carotid artery just above the level of hyoid bone in the neck. So answer is A. Next question, the leafed vascular area in TMJ is it's at the central part of the articular disc. Well, we know that TMJ, it is a synovial joint that allows the movement of jaws. It consists of mandibular condyle. That condyle articulates with the mandibular fossa. That is a part of which bone? It is part of temporal bone. So in the TMJ there is an articular disc that separates the two bones. So this articular disc, it is avascular in the central region. That means that it has very few blood vessels, or it is devoid of blood vessels. So this avascular zone in the central part of the articular disc is referred as avascular zone. So lack of blood vessels in the central area of articular disc is the one of the main reason why the healing capacity of TMJ is limited compared to other joints in the body. So the damage, if any occur in the central part, it may not heal and it takes time due to its limited blood supply. So imagine your jaw what as a door hinge that helps to open and close your mouth. Now this hinge is not simple hinge, it is just like more complex. Inside it there is something like cushions or cushion pad. So this pad, it is known as articular disc. So this disc sit between the two important part of your jaw. The upper part, the temporal bone, and the lower part is the mandible. So it is a soft layer that prevents these two parts from rubbing directly against each other when you move your jaw. So right in the middle of this cushion disc there is special zone that is called as no blood zone. So this zone is a bit different as it does not have tiny blood vessels. It is like a desert with very few water sources. So when you use your jaw to eat, talk, or even yawn, so this cushion jaw will help you to move TMJ very smoothly. But because the middle part does not have many blood vessels, it's not great at healing. So if there is any chances of injury, it's like having a weak spot in your armor. So mark answer D as your choice. True about the muscle of facial expression. So well, this image is directly from an open Google source. The statement A is not correct. The muscle of facial expression, they are derived from the mesoderm of first branchial arc. No, they are derived from mesoderm of second branchial arc. The second branchial arc give rise to structures primarily innervated by the facial nerve. Option B, they receive motor supply from the trigeminal nerve. The muscle of facial expression receive their motor supply from the facial nerve and not the trigeminal nerve. The trigeminal nerve primarily supply the muscle of mastication that are responsible for chewing. Option C moves the facial skeleton. The muscle of facial expression do not move the facial skeleton, that is the bone of skull. Instead, they move the soft tissue of face, such as skin and underlying structures. So these muscles, they are responsible for various expressions like smiling, frowning, raising the eyebrow. Option D have bilateral cortical representation in the region of forehead. So that option is correct. So this means that area of brain, it is responsible for controlling these muscles that are found on the both sides of cerebral cortex. Imagine you are looking in a mirror and you want to raise your this right eyebrow. When you decide to do this, the brain will send signals to muscle on the right side of your forehead to make your right eyebrow go up. So at the same time, the brain also sends signals to muscles on the left side of your forehead to keep everything balanced. So this is why you can independently raise either your right or left eyebrow and make different facial expression. So the bilateral cortical representation in your brain allows to have fine control over the muscle of facial expression, especially in the forehead region. Moving to next question, the first part of vertebral artery, it extends from origin to the answer here is a B. The first part of the vertebral artery, it originates from the subclavian artery and extends to the transfer process of sixth cervical vertebra. The middle layer of masseter, it arises from, the middle layer of masseter, it arises from the anterior 2/3 of the deep surface and posterior 1/3 of the lower border of the zygomatic arch. So there are three layers: superficial, middle, and the deep layer. The superficial layer, it arises from the anterior 2/3 of lower border of zygomatic arch and adjoining zygomatic process of maxilla. Whereas the middle layer, it arises from anterior 2/3 of deep surface and posterior 1/3 of lower border of zygomatic arch. Whereas the deep layer arises from the deep surface of the zygomatic arch. And they are inserted, the fibers are inserted on the ramus and coronoid process of the mandible. The facial nerve, it exits from which foramen? Well, foramens are very important for your entrance exam point of view. Many of questions on the foramen they have been asked. So the answer is stylomastoid foramen. So remember all these foramens: foramen magnum, hypoglossus canal, foramen spinosum, foramen ovale, jugular foramen, their location. Very, very important as per exam point of view. Next question, the parotid duct, it opens into vestibule of the mouth opposite to the crown of, this question we have already discussed in the previous MCQ. The answer is the opposite second molar tooth. The parotid duct, it is also known as Stenson duct, that opens into vestibule of mouth opposite which molar? Crown of upper second molars. Remember, opposite the crown of upper second molars. So that is your answer. The next question, the inferior sagittal sinus, it joins with greater cerebral vein. So the inferior sagittal sinus, so this one is the inferior sagittal sinus, it joins with the great cerebral vein. So this one is the great cerebral vein, and they together will form what sinus? This is straight sinus. So easy question directly asked from BD Chaurasia. Remember this diagram, very important for your exam point of view. Just go through all the diagrams mentioned in BD Chaurasia. The floor of the cavernous sinus, it is formed by the floor of cavernous sinus, it is formed by endo-ostial layer of dura mater. The roof, it is formed by meningeal layer of dura mater. The lateral border, it is formed by meningeal layer of dura mater. So the dura mater, the outermost and the toughest of the meningeal layer. So it has two layers. One is the endo-ostial layer and other is the meningeal layer. The endo-ostial is the outermost layer and it is attached to the inner surface of cranial bone. It contributes to the formation of floor of cavernous sinus. The meningeal layer, it is innermost layer of the dura mater and it is closely adherent to the brain. So the meningeal layer, it will form the lateral wall, root and the medial wall, while floor, it is formed by endo-ostial layer. Diaphragm cellae, it is formed. The diaphragm cellae, it is a dural fold that is formed by the endosteal layer of the dura mater. So it is a horizontal sheath of dura mater that covers the sella turcica, a bony structure in the base of skull that houses the pituitary glands. Which of following structures pass through the center of cavernous sinus? The answer is internal carotid artery and abducens nerve. So the internal carotid artery passes through the cavernous sinus. The abducens nerve, it also passes through the cavernous sinus. So both the internal carotid artery and the abducens nerve, it passes through the center of the cavernous sinus. The hyoid bone, it is at level of, well, remember these, the points. The body of hyoid, it corresponds to the C3 cervical vertebra. The thyroid gland, it is located below the hyoid bone between C4 and C5. The cricoid cartilage, it lies just below the thyroid cartilage at level of C6 cervical vertebra. So remember all these vertebrae. The answer is A. The sensory nerve supply to sternocleidomastoid is through the ventral ramus of C2 nerve. So that this nerve is responsible for proprioception that involves the sensing the position and movement of the muscle. The spinal accessory nerve, it primarily provides the motor innervation to sternocleidomastoid muscle. The skin of neck, it is supplied by cervical nerve C2, C3, C4. The front belly of occipitofrontalis, it is supplied by the temporal branch of the facial nerve. The occipital belly is derived from the lateral 2/3 of superior nuchal line and it is supplied by posterior auricular branch of the facial nerve. The front bellies, they are supplied by the temporal branch of the facial nerve, and the occipital bellies, they are supplied by the posterior auricular branch of the facial nerve. The superficial fascia in scalp, well, it is more dense, more fibrous and dense in the center. The superficial fascia in scalp, it is more fibrous and dense in the center than the periphery. So this center, it is known as cilia aponeurotica. It serves to bind the skin to the underlying structure, including the cranial aponeurosis. The second cervical vertebra is characterized by, well, the second cervical vertebra, it is also known as axis. It is characterized by a presence of dens, that is also known as odontoid process. It is like a tooth-like projection from axis bone and it acts as a pivot joint for rotation of the atlas. That is the first cervical vertebra and the head. So that helps to allow movement of the head from side to side. The posterior boundary of the jugular foramen, it is formed by, the answer is jugular process of the occipital bone. Which of following is not a suprahyoid muscle? The answer is omohyoid. Well, omohyoid, sternohyoid, sternothyroid and thyrohyoid, they are the infrahyoid group. The omohyoid muscle, it is not a primary suprahyoid muscle. It is a part of infrahyoid group of muscle. The suprahyoid muscle include the digastric, mylohyoid, stylohyoid, which are located above the hyoid bone. Mesenteric nerve, it is branch of anterior division of the mandibular nerve. It innervates the masseter muscle and it helps in elevating the mandible to close the mouth. and the process of clenching the teeth. So answer is C.